This is the Fox 11 News at noon.
Up next, have you made your healthcare selections for next year?
It is open enrollment season, and we have an expert joining us to tell you what you need to know for 2019.
And speaking of your health, shall we talk about open enrollment?
Let's do it.
Yes. Have you completed open enrollment? Now's the time to sign up for the right health insurance for you and your family.
There have been some changes this year that might impact your decisions. Joining us now to discuss open enrollment is Mildred DeJesus of LA Care Health. It is the largest publicly operated health plan in the United States.
Welcome.
Hi, thank you. I'm so happy to be here with you.
Well, we're happy for you to shed some light. So we mentioned changes. What changes should people be on the lookout for?
Well, there are a couple of changes off the top. The sign-up period. So Covered California is now calling the open enrollment period sign-up period, which is great. And also the dates. So the sign-up period dates are October 15, so it's already started, through January 15. But we don't want to wait too long, because if you want to be covered for January 1st, you do want to remember that December 15 will be your cutoff for that. But generally, January 15.
When you talk about changes, I think people get a little bit concerned, because change to them might mean the changes in premiums, and that these premiums are going to go up year after year, and they're going to have to pay more out of pocket, obviously, for their plans. What would you tell them? Yeah,
that's a great question, Bob. But really what we want to think about is that the premiums, the biggest increase was last year, given that the subsidies for the health plans went away. So that's pretty much in the bag right now. Although there have been some increases this year, what we really want to focus on is the importance of having health care coverage. So Angelinos right now, Southern California residents have a lot on their mind, given the fires, given everything that's happening. So that's an important piece to remember. Are you covered? Do you have health care coverage in these times? You want to make it a priority to have health care coverage, because life happens. And so we find that if you're in a hospital bed, what you really want to be concerned about is getting better, as opposed to, do I have health coverage? What is this going to cost me?
Right, after the fact. You want to be signed up before. So are you hearing from people directly? And what are their biggest concerns or most pressing questions for you?
Well, their biggest concerns is, what's the cost? How much is this going to cost me? And one of the things that we urge everyone to do is really look up. You can look up online as to how much a broken leg might cost, for example, if you don't have health care coverage. And that sounds dramatic, but we really want to emphasize the importance of having health care coverage.
But people might be surprised to know that they are potentially eligible for a subsidy, that you're not going to have to pay the full amount anyway, because there is help out there.
That is correct. So 87% of LA Care covered members are actually eligible for subsidies. So that's important. And some of them may even be eligible for Medi-Cal. So there are things out there to help you out. Not everyone is paying the full premium.
For first step, they should just go to your website, to one of the various websites out there, to just try to get the information, because it may sound really daunting, but the information is out there.
Absolutely, and you want to consider LA Care Covered as sort of the home team of Los Angeles. We're there for you. We're a resource. So lacarecovered.org, there's coveredca.com, and there's healthcare.gov. So there are many resources out there to get information.
Open enrollment is underway right now.
Open enrollment is underway.
Sign up.
That's correct. That's right. Sign up.
Sign up. And if you want to be covered January 1, you need to be signed up by December 15.
That's right. So you don't want to wait.
Get your insurance. Be healthy.
Yes. Mildred DeJesus of LA Care Health. Thank you very much.